Hi, I'm Dr. Sridhar Kalyanasundaram. I hope you find these short snippets useful. And in this video, I will discuss about umbilical granuloma. I mentioned in the previous video on care of the umbilical cord that some granulation tissue remains at the base. A granulation tissue is healing tissue and it shrinks and heals that area. It happens with any wound, and the umbilical cord separation is a wound as well. Obviously, colonizing with healthy bacteria helps this process, and sometimes the granulation process is exaggerated. It leads to something called umbilical granuloma, and umbilical granuloma is usually small and it shrinks with time. Normally, we just suggest to open the umbilicus as we described in the previous video and clean with alcohol swab once a day or so. And it usually settles down over 7 to 10 days. If there is no discharge, if there is no infection, you don't need specific treatment. If it is a reasonable sized umbilical granuloma, we have what's called the grandmother theory, and grandmother's treatment with common salt is often shown to help, and even the NHS has adopted this in their guidelines. So we can apply a pinch of salt on the umbilical granuloma. You leave it open for 2 to 3 hours and don't rub it to remove it. You wash it off because the salt has crystals, and if you rub it, you may cause abrasion and it may bleed. So umbilical granuloma usually shrinks after 5 to 7 days of such treatment. However, if you notice any concerns, you may need to discuss with your pediatrician about use of chemical cautery. Very rarely it's a big swelling, in which case you may have to differentiate from an adenoma and you may need to consult a pediatric surgeon, and they may do surgical removal or cautery removal if they're convinced that it's not an adenoma. An adenoma can be more serious. It's usually red appearing and bigger. Some discharge may be there. So these cases should not be ignored and they should be evaluated more carefully. However, majority of the time the umbilical granuloma is simple, and as I said earlier, it resolves either by just cleaning and monitoring or with a little bit of salt. I hope this helps, and do share. Thank you.